You're now listening to The Lunch and Learn with Dr. Barry. This is episode 4.
Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to this episode of The Lunch and Learn with Dr. Barry. And on this episode, we're going to be talking about Men's Health Month. And I'm going to dive into why it's important, other than the fact that it is in June. I'm going to talk about 4 pillars of men's health that we have to kind of look out for. We're going to talk about reasons why men need more help than they're actually receiving. And we're going to talk about the one central issue that kind of keeps tying all of these things together as far as what men's health is concerned. And last but not least, we're going to talk about how important it is to get the loved ones involved in taking care of the men. Because believe me, when it comes to men, we find every excuse not to take care of ourselves. And our loved ones are usually one that puts us back in our place. Today, we're talking about, hey Jesse, thank you for joining. Today, we're talking about men's health. And why are we talking about men's health? One, for most important reasons, it's the month of June, and June is all about men's health month. Hey man, thank you for joining. And so we're going to be talking about men's health. We're going to be talking about a couple things that, from my personal experience, what we can do to try to better our men's health, and what been some of the reasons kind of been holding them back. For the most part here. Let me go ahead and, do my little start that off. Let's get this show on the road here. So again, why is it important to even have a focus on men's health? The big reason is that for the most part, and I always attribute, and this is what I love. This is why I always attribute to the women of our life. And I actually wrote on this as well in the past. Is that as men, we definitely take our health for granted. And a lot of it, either it be societal reasons, we have a lot of this machismo type, juice kind of dripping off of us. And a lot of it is fear as well. So a lot of us, we have a fear of knowing, so we want to, if we don't know, that we're sick, if we don't know that we're at the healthiest that we can be, if we don't know that there's a problem there, then we're able to kind of continue to maneuver. So a lot of that keeps us from going to seek help when we need it. And and when I talk about health, and I'll talk about a few things. The most important, when I have a male in my office, most of the time, it's either some type of sexual issue, usually impotence or something in that regards. Is a big factor, or a lot of times, there's some partner that's pushing them and getting them into the doctor's office, right? So that's usually one of the first. That's usually a couple of top 2 reasons why I tend to see men in my office from that standpoint there. And the reason why we even have I forget what month is Women's Health Month, so don't kill me. The reason why we even have this Men's Health Month is because we have to try to spotlight a lot of the medical issues that men are dealing with at such a rampant rate that we have to kind of bring to light. Because if we bring it to light, then men tend to be will tend to be a little bit more comfortable in seeking treatment for these things, right? So I'm going to talk about just 4 topics that that I kind of hold near and dear, right? So the first one, right, is the emotional health, right? The emotional health of men, right? So that's a big thing that my men, especially my men, seem to have a very big problem dealing with, being able to accept, and then being able to seek help for it, right? Because one, we don't, and I say we because I'm part of the choir, right? We don't like to seek help. We don't like to, because a lot of it, if we seek help, then we feel lesser than thou. So just admitting that we need any type of help is, for those who haven't driven with one who don't want to even ask for directions, what that problems arise. So, we deal with that for the big part, right? And then secondly, just being able to admit that we need help, right? We almost feel that, we'll be mocked amongst our friends. So even those who are seeking help, especially from the emotional standpoint, tend to keep it a secret, right? And if you're dealing with any issues, especially when we talk about emotional health, we talk about depression, we talk about anxiety, we talk about all of these stressors that are on men that a lot of times is self-placed, but a lot of time, it's placed on them for a variety of reasons. When we talk about like those pressures that kind of get told on them day in, day out, it adds on to a lot of pressure that again starts trickling into the emotional help, dealing with blood pressure issues, dealing with diabetes issues, dealing with weight issues. I have there's a lot of men, right, who feel the stigma, right? This is because a lot of stigma out there that, a man should be a certain way, a man should, take care of, the household and, should be, the quote unquote alpha of their family. Dr. Don, thank you for joining. And a lot of time that puts so much undue stress, and I see it, right? I see it quite often when they do finally show up and, into our offices, and, they're dealing, not only are they dealing with their blood pressure that they can't seem to control, not only are they dealing with their diabetes that they can't seem to control, not only are they dealing with the weight issues that they can't seem to control, and then when you add on this extra immense pressure, that they get outside of the doctor's office, that's placed on them at work, that's placed on them in their homes, that plays a toll. And that's something that I see quite often. And a lot of the tricks I have to do, especially for men, right? Like, especially my men, I don't even like to bring up mental anything. I don't even say those words because that's enough to kind of say, oh, no, doc, I'm fine, right? They go to shutdown mode very quickly. In that sense, right? So for my men, you have to earn their trust, right? You have to earn their trust to say, you know what, I think you have a problem, and I'm here whenever you are ready, to seek help, right? And I have a lot of men who, especially in my practice, who, I see, 2-3 times, and like, a 4 to 6 week span, right, Genevieve? And the reason why I do that is because, like, I'm working on, like, like, I know I can't bring this subject on this appointment. I'm gonna wait a few more appointments before we start saying, like, hey, I think you need some help. Like, what do you want me to do? And for men, you always got to leave it in their corner, right? I can tell you this is the word wise and true, right? You always make it seem like it's their decision, right? To want to seek help. Always make it seem like it's their decision to want to seek treatment, right? Because if they feel like it's getting forced on them, they're not going to do it. So the emotional health is something, especially during a month like this where we're spotlighting men's health in general, we definitely have to keep a focus on, right? Second, substance abuse. Substance abuse, and again, not to say that it doesn't happen for women, but it's such a pronounced effect, especially on the men when it comes into alcohol, when we talk about drug abuse, when we talk about all of these things here. That plays such a role that it affects everything else, right? They're, and again, and you'll see, like, I'm going to intertwine a lot of these things here, but a man who is dealing with emotional problems usually isn't going to, seek counseling, usually isn't going to seek, therapy or treatment. What do they do? What do they see? They seek it in their vices, right? So they drink more alcohol, they smoke more cigarettes, they do all of these things, like, outside of what a normal treatment regimen should be, because of that stigma, because of that initial stigma of, I don't want to be labeled, and men hate to be labeled, especially in anything that doesn't, elevate their status, right? If I call them the alpha, they're ready for it, right? Yes, I'm the top dog. They're ready for it. But if I say, you're depressed, you're anxious, you're succumbing to a lot of stress, anything that kind of lowers their stature, they want nothing to do with. From, hey, Dr. Hendry, thank you for joining. So it's important for us to see how, like, when we don't take care of the emotional and mental health of the man, how that leads right into issues of like substance abuse, right? So you're going to see, and I'm going to do a few posts this month on substance abuse and how much it's affecting, the male population, right? And how much is not only affecting them, right? Because again, a lot of these, their vices, there are, I keep saying they're like I'm separate. A lot of our vices don't only affect ourselves, right? They affect our loved ones, they affect the children, they affect our work, they affect all of these different these avenues, because we can't keep it together, right? And again, and I can tell you, men, we're terrible at it, right? We can't really keep our problems to ourselves. We just show it out in different ways, right? Like we're probably not gonna go to our homeboys and say like, hey man, I'm stressed, but I don't know what's going on. We're probably not going to do that. We'll probably drink with them. We'll probably be a little bit more aggressive with them. We'll probably want to fight. We'll just do just off the wall stuff because we have not learned. And and you can blame society. There's a lot of reasons, but we have not learned to be able to kind of deal with a lot of these stressors in the correct way. Society. There's a lot of issues behind that, but we just haven't learned how to become better people without trying to sabotage ourselves, which we do quite often from that standpoint there. Now, for one thing that they will come to my office, and we kind of alluded to earlier, their sexual and reproductive health. I think I did a lunch and learn last week on the testosterone therapy, right? And testosterone and just replacement. Majority of the time when I get the men in my office, the majority of the time it's like due to this, right? Because their sexual and reproductive health, which again, remember how we follow the train, which again ties into our mental stature in the world, which again ties to our place, our quote unquote machismo in the world. When that like avenue like succumbs, when they start having trouble in the bedroom, when they start having trouble satisfying their partners, the doctors hear about it very quickly, right? Because that's not something like, again, for some reason, like I guess I gotta thank the Viagra's and the Cialises of the world, because they'll come to take care of that immediately, right? Like they're not gonna just kind of linger along and allow their sexual prowess to be like under quote unquote attack, right? So if they feel like anything's like messing with that aspect of their life, they're gonna seek help, right? And a lot of times I like to use that in the way of being able to like talk about other things, right? And I can tell you, and let me just divert. Let me show you how they usually talk about it in their office, right? Especially for the one who may wear it. Usually they come in with some like very vague complaint about arm pain, back pain, something very vague. 9 times out of 10 doesn't even matter, right? They come with some vague issue because they need a reason, again, because remember, like we have this stigma, right? So we don't want to feel lower than we want to be. So we have the stigma. So we'll say, like, I'm going to the doctor's office, my back hurts, or I got a cold, or some real reason, right? And almost like clockwork, right when I do my physical exam, I'm ready to I give them the game plan, I'm ready to hop out the room and say, Doc, hold on for a second. And Dr. Fakar, my student, will tell you, Dr. Farouk will tell you, we get this all the time, right? Like they stop and they say, hey Doc, I'm having some problems, and like once they say like, of course I know, right? So that's like the number one way they let me know they have a sexual dysfunction, right? Because and even then, even though the main reason why they're at that doctor's office is to deal with the sexual dysfunction, they still do it in secret, right? So they still do it to the point where they don't even they won't tell the front office, they won't tell my MA, they won't even tell me until like I'm ready to leave. Like sometimes like my back is turned, I'm ready to leave the room, and then all of a sudden like before you leave, this is happening. And when we talk about sexual and reproductive health, especially for the men, they're always blaming it on low testosterone. That's like the number one, like, escape. Like, the testosterone, I'm getting old, all these reasons. But a lot of times, especially when we talk about, sexual and reproductive health, a lot of times that can be like telltale signs for other things, right? because when we talk about impotence and erectile dysfunction, the penis is a vascular organ, right? So if you're having any vascular issues, let's say you're a hypertensive, let's say you're a diabetic, let's say you just have some type of like disease that causes plaque, like high cholesterol. If you have those risk factors, a lot of times the first time we even see any problems is when you complain about erectile dysfunction. So you may come to me complaining about erectile dysfunction. Next thing you know, I'm sending you to the cardiologist, right? And that's happened quite often too. And they're always like surprised, like, what do you mean I need to see a heart doctor? Like, no, I'm having problems down there. And I always let them know, like, no, if you're having problems, if you're having vascular issues there, you're likely having vascular issues elsewhere. So I'm very cognizant of that from that standpoint. Just to make sure, like, because again, like I said, it's not a one touch all see all thing. It's like if you're having problems, especially from a sexual dysfunction, one, I'm glad you came to the doctor's office because at least I got you to come in here. But two, I'm able to kind of segue, and I usually will, tell them like, well, if I don't take care of the heart issues, or if we don't take care of the blood pressure issues, if we don't take care of the diabetes issues, then you'll never be fine when it comes to the erectile dysfunction. And that sometimes is enough to like get them going from that standpoint. Because again, like I said, men tie a lot of things to their stature. They tie a lot of things to the stigma of these disorders. So if you start seeing that breakdown, you start seeing those issues in the sexual reproductive health, and it trickles right back to, right. So they start getting more depressed, they get more anxious, more everything like kind of falls in line, right? Because I can tell you, us men, we don't deal with that type of quote unquote failure very well, right? So if we're having failure in the bedroom, we're having failure when it comes to our jobs, we're having failure when it comes to dealing with the stresses of our home, that manifests, right? That manifests, and what I gotta do, I go get an alcohol, I go get a drink, I go do something from a substance abuse standpoint, right? Because all of these things, again, because all medicine ties along one way versus the other, right? So that's always a concern that I deal with, and I try to help like show them that like, no, all of this kind of ties together. Like if I don't take care of one thing, I can't take care of the rest from that standpoint, right? And so that's why we talk about prevention, right? So that's why we highlight these health months, because again, you guys been around, and every month, like I feel like I'm highlighting some other disorder. But the reason why we do that is because when you don't, sometimes it's kind of dropped to the wayside. So that's why prevention is so important, and that's why getting to the doctor's office is like extremely important for the men. Getting to the doctor's office, doing their regular checkups, even when they don't quote unquote feel bad, is so important. Because I gotta make sure, there's prostate cancers I gotta deal with, there's colon cancers I gotta deal with, lung cancers, all these cancers that affect men just as much as they affect women. Some especially in the case of prostate, because they're the only ones who have a prostate, affect them more. It's so important to like get them seen, and get them seen early. Because again, men tend to, because they tend to go to the doctor's office later than others, we tend to find their diseases later than others, and we tend to have difficulties treating their diseases more than others, right? So that's where all of these things kind of keep continuing to tie along. So that's where, hey, Dr. Kendra, so that's why it's so important for the men's and this men's health month, throughout. I mean, of course, men, we should be taking care of our health on a yearly basis. And again, when I say our health, I'm not talking about just our sexual health, right? We should be taking care, making sure our cholesterol is great, making sure our blood pressure is great, making sure our blood sugar and everything else that kind of falls into line is doing well. And then at the end of the day, because if we take care of all of these things in the forefront, then our emotional and mental health isn't a concern, right? We're not dealing with these things because we're taking care of them as they come along. But when we allow them to linger on, when we allow them to cause any problems, very, very, when we allow them to cause any problems, that's where, the problems arise. And that's very true, Dr. Kendris. And it's very, very, very often when my guys come to see me in the office, they say, oh, my wife made the appointment for me. That's it. My wife made an appointment for me, and that's why I'm here, right? Yep, man. And I say this, I'll say this like 100 times, right? If it not for women, like we'd be dying even earlier, right? Like women like keep men alive almost like an extra like 10 years, right? Because like they're honest, because they're more conditioned, and I don't know, but they're more conditioned to see physicians when they're not feeling well. They're more conditioned to see physicians when they're feeling well, right? They're more conditioned from a prevention standpoint, right? Whereas us, like if it ain't broke, we're not trying to fix anything, and we're not trying to see if anything's broke, right? So you got that like caveat, right? Like we're not trying to fix anything if it's not broke, but we're also not trying to see if anything's broke. Like we need a stroke to happen for us to be like, oh, now I need to go take care of my blood pressure. Now I need to take care of this cholesterol, right? And that's the mindset that we have to kind of change. From our standpoint there, we have to be much more aggressive, just like when we're aggressive when we're talking about sports, just like when we're aggressive when we're talking about financial prowess, sexual prowess. That's right. We're just like how we're aggressive in like those topics. We need to be aggressive when we're trying to take care of our health. And of course I call out all of my my male friends, and like get it together, right? Especially my young guys, right? Who just if I say, what did I say with the doctor, it's like goes right over the head, right? Because again, we tend to feel like we're invincible, and we don't need to see the doctor. We don't need to see the doctor again. So if you know any male friends who hasn't seen the doctor in like years, like get them to see a doctor. Especially in this day and age where we don't know where healthcare is going, and we don't know what's going to be happening next. It is extremely important, right? To get them in and get them seen like quickly, right? Like yes, like well, my father was the same way. Just to just from a backstory standpoint, if let's say again, I'm pretty sure no one on this like live stream is gonna be a culprit, but let's say you didn't get the making of the medical mogul, right? Hey Calvin, thank you for joining. Hey no, thank you for joining. Like I talk about how my father again, I was in medical school. I think I was a second year student, and my father had hypertension, diabetes. He never told nobody. When I found out my dad had any medical issues, when I called the house one day and they told me he was in the hospital, and I was like what? So that's what happens, right? How do I give it? We're gonna talk about that, Dina. Sorry, Sister Marie. We're gonna talk about like how can we get men to the doctor's office, right? For just going back, so until my father was actually in the hospital was the first time I knew he had any medical issues, right? Why? Because he never went to the doctor's office, never told anybody about going to the doctor's office, and unfortunately, it ended up, kind of being kind of his demise, right? He actually ended up passing away from complications of an aortic aneurysm. And from just a clinical standpoint, aortic aneurysm is something that progressively gets worse over time, and by time we mean like years, because of issues with uncontrolled high blood pressure. Right. So this is a person who, if somebody could have got to him, right? Somebody could have got to him and just put him on 1 or 2 blood pressure medications, is probably still here today. So that's why it's so, thank you everybody. That's why it's so important from a prevention standpoint, right? Because we have a lot of diseases that, like, especially, and I'm talking to the men, like the women got the issue, but I'm talking to the men, right? We have a lot of issues that we deal with. We have a lot of issues that are killing us that we could easily prevent it, right? I'm not even going to talk about like colon cancer, right? Like, I got a lot of men who, and I don't know if it's from a homophobic standpoint, I don't know what the reason is, they don't want the colonoscopy, right? And they're allowing colon cancer to get them out of here. Colon cancer, like if you had to choose, and you said, Dr. Barry, what is the one cancer that I would give myself? It would be colon cancer. Why? Because colon cancer is such a slow-growing cancer. It's the reason why you can do a colonoscopy today and not be seen at all for like 5 to 10 years. So, but you have people actually dying from colon cancer because when they're like literally refusing to get a preventative test that could get that out the way quick, fast, and hurry. Because 100 reasons. Again, like, and especially my men, are definitely much more reluctant to get that. So that's our problem, right? We're dying from a lot of preventative diseases because our machismo is not allowing us to go get a doctor's appointment, right? Our machismo is not allowing us to take our medications. So some of us are going to the doctor's office and then we're still not taking the medications, right? So again, so we're not helping no way, no how, right? So a lot of us are going to the doctor's office because the wife, girlfriend, sister like made me come to the doctor's office, and then when I find out I got something, I'm still not following the direction of the physician. So that's why again men's health month. That's why it's such a big thing to again just to kind of again put the spotlight like to say, hey man, like get it together, right? And earlier someone asked like, how do we get our men to the doctor's office? The big thing for them is you gotta nag us, right? You gotta nag us, nag. You gotta nag us, but then when you nag us, you gotta almost make it like our decision, right? Because if we're going, because you keep nagging us, we're probably not gonna follow any directions once we get there, right? Like you gotta nag us to the point where you say, you know what, like, all right, I gotta go, and but I'm the one who made the decision to go, right? Because if we feel like we're the one who made that decision to go to the doctor's office, we're more likely to follow the directions when we do go there. From that standpoint, and again, like I said, it's very men are slow, right? We're slow. I'll be the first to admit it. We're slow when it comes to our healthcare, right? We just don't be doing it right. we just be doing it right. So so that's the problem, right? We always think we know more, right? We always think we know more. We always think we know more than the doctor. We're just trustful of the doctor, and then again, but that's a whole different discussion in and of itself, right? Because once a man goes to the doctor's office, he's really got to trust that person, right? He's really gotta trust whatever that doctor is saying, or he's not gonna listen, or he's not gonna follow the direction, right? So it's it's hard. It's hard. Where, like I said, there's a reason why we die much earlier, especially when we don't got y'all, right? There's a reason why we die much earlier, right? Because we just so hard headed. We're just so hard headed, and like I say, I got patients in my office. Like again, it takes me 3 to 4 appointments just to get them to, let's say, like, hey, I think you're depressed, even though like. Clear as day, you're screaming depression to me, but it takes me about 3 or 4 appointments just to get us to that point, right? So that's unfortunately, we got to work on this, like, we're, and I'll continue to work on, our guys, from that standpoint too. Oh yeah. Well, that's the big thing too, Sister Marie. It's, especially for the Haitian community, really just any community in general. We rather go to people who look like us, right? So my Haitian patients have no problem coming to see me. Why? Because when they come to see me, I can speak Creole and boom, boom, boom. Like they're more likely to follow our directions. But what tends to happen, especially in our community, Haitian, Black, just in general, because the majority of the doctors we go to see don't look like us, we already don't trust them. And because we already don't trust them, that disconnect goes there, right? And once that disconnect comes there, it's very difficult to like get them to kind of like hop on the train. From that standpoint, yes, thank you, Amanda. You do, like, because but like I can tell you what happens, Amanda, especially for men. If you ask us that, most of the time they're gonna say no. And the reason why they can say no, because Amanda asks, like, do you have any health concerns? That's like, she likes to ask direct questions. And a lot of times they'll be like, no, I don't have any problems. Why? Because they probably never went to a doctor's office to even tell them what their problems are, right? I got patients I got a fortunate patient who, I swear, if I could have met him 5 years ago, probably let's say 5. If I could have met him 5 years ago and I could have put him on one blood pressure medication, he wouldn't be on dialysis today. By the time he walked into my office, his blood pressure was already 180, 190, 200, and he was just chilling. So it's been 180, 190, 200 forever. And by the time I saw him, I was already sending a referral to the kidney doctor because, like, yeah, you're probably gonna need some dialysis. So, and that's the issue, right? You go through life. You don't feel nothing. You don't feel bad. You deny even when you do feel bad. And then once you get older, that's when problems arise. That's why we die earlier. That's why we suffer much more from all these diseases, especially from a cardiovascular standpoint, diabetic, and all that standpoint as well. So that's where we're at. If we could just say one thing, the big thing is just prevention. Prevention for our men, and getting them together and understanding that we're hard-headed, and because we're hard-headed, it's probably going to take more than one like push before we go to the doctor's office, right? It's going to take it is going to be more suggestion, like it's going to take more and more persuasion to get them to go there.
unless it's sexual. Again, and I put that asterisk on there, unless it's sexual, right? Because if it's a sexual problem, oh boy, I'm gonna see them. I'm gonna see them quick. But even when I see them quick, they're not coming that's not the first thing that they're gonna tell me. It's usually right before they're about to leave my office and they want to let me know, right? So even when like they're driven to say, no, I gotta go see this doctor, if not for anything, to get some like Viagra or one of these medications here. So even when like that's their main focus, they're still embarrassed, and they're still weighted down by the stigma of what it means to need and seek help from that standpoint. So, and we can only do so much, right? That's why we do this month. That's why we highlight this month, just to try to get them, to a better state from that standpoint that they are before. Tomorrow, a lot of people don't want me on meds, so they avoid. They. Well, and that's a very good thing. Amanda states that a lot of people don't want to be on medication, so they avoid the doctor and they try natural stuff and diet and vitamins, right? So let me speak for the doctor. Let me sit up, right? Let me speak for the doctors because it's funny, right? Because I have patients, right, who I can't get them to take their blood pressure medication every day, but they'll take a natural supplement medication every single day. Like, so you see the logic from a physician standpoint, how we're looking at y'all, right? You won't take my blood pressure medication, but you'll take a natural supplement every single day. And a lot of that, again, is just a distrust, right? Like, for some reason, you don't trust that the blood pressure medication is going to do you well. But for some reason, you'll take turmeric. Some reason you'll take, like there's a whole bunch of but like for some reason you'll take that supplement every single day, and they'll tell me, and when I repeat that and I say, oh, so you'll take like so and so every single day, but you won't take so and so every single day, and they usually have no comeback, because like in their mind they didn't really think all that out, but they do it all the time. Like I said, this is definitely not an isolated incident, but like they do it all the time for some reason, and it's crazy because if you think about it, these natural supplements, there's the regulation on these natural supplements is nowhere near the regulation on a blood pressure medication, on a diabetes medication, on a cholesterol medication, on a gout medication, on a seizure medication. The regulation that like these natural supplements have is nowhere near that. But for some reason, your trust has been placed in this natural supplement much more than it is on the other medications. But again, like I said, I try not to argue with it. I just kind of let them, sometimes when you say it out loud, they're like, you know what, that doesn't make sense, because it really doesn't. Like, especially from a physician standpoint, doesn't make sense whatsoever, right? Exactly. 3-4 vitamins a day. Boom, 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 boom. No problem, Dr. Don. They'll do it 3, and then I'll be looking. I say, yeah, well, why can't you just? And sometimes, and it's not even, and I'm not even factoring the cost of the medication, because I'm talking about there's medications that are for free that I can't get them to take every single day, but they'll take that melatonin, they'll take that turmeric, they'll take that vitamin D, they'll take the vitamin D, they'll take all these other medications before they take that one that I want to prescribe them. Again, so it's one of those caveats that we again have to go back for over and over again from that standpoint. Dependency on particular medication. Okay, very good issue as far as a dependency on a particular medication, because they want to be cured, right? And my always come back for that is a lot of times, this medication is what cures you. Like, a lot of times you can have the best diet and your blood pressure is still going to be high. You can have a zero salt diet, nothing but your blood pressure is still going to be high. You can have zero trans fats and your cholesterol is still going to be high. You can avoid carbs like the plague and your sugars are still going to be high. So a lot of times when I try to make them understand that, sometimes, and especially for my religious patients, so I say, God put those natural supplements in there just like he put those medications that I'm prescribing you to treat you. Like that. So that's how I try to do it. I like, just like God put these natural supplements, these plants in the world to get you better, to get you sleeping better, to get your vitamin and your energy level and your memory better. He also put these other medications here, and he also put people here, nurses, physicians, pharmacists. He also put all of these people here as well, because they know that we can cure you as well too. So that's a very good point. Like, they're afraid. Like, a lot of people are just afraid to have to take a medication every day. And I just tell them, sometimes, the way God works, your genes just have made it so that you got to take something. And I always compare it to this. I say, you could take this one, especially for, let's say, high blood pressure, diabetes. You can take this one medication, this pill every day, or you can be on dialysis, or you can have a stroke and then someone has to bathe you, or you can have a heart attack and die. Like, I always compare it to that, right? Because you have to go super extreme with them, because they already going extreme with you, right? So they don't want to be on a medication for the rest of their life. I say, well, yeah, it's fine, but you also don't want to have a stroke either, because again, I think we don't pay any mind as far as like the severity of the risk of not treating, right? The risk of not treating, especially in this day and age, right? Before, if you had a heart attack, you had a stroke, yeah, you probably are out of here. You're probably, you're passed away, gone. But medicine has gotten so good that if you have a stroke, heart attack, we're doing enough to keep you alive. Now, by alive, you may be on a wheelchair for the rest of your life. By alive, you may be on dialysis for the rest of your life. By alive, you may have half of your body, be paralyzed and you need assistance everywhere. So the definition of alive may be drastically different, but we do a great job of keeping our very, very sick people alive now. So that's why it's important to understand that if that's the route you want to go, and that's what I always give them. Like I say, this is your options, right? You don't have to take your medication, but if you get that stroke, you'll have to deal with that consequence too. If you get that heart attack, you have to deal with that consequence too. If you my diabetics, if you don't want to, follow the diabetic diet, and I got to take your foot off, I got to take your part of your leg off. If that's what you want to deal with, it's your choice. But like as a physician, my job is to show you that like these are the paths you're going if you don't go the right way. From that standpoint there. So again, very, very, very great point on, medications and, and like I said, our men don't like taking medications. Woo! Lord, I can't get, again, unless I'm talking about that Viagra. And again, and you'll see a very common theme is that men do a lot for their significant others, right? They do a lot for their significant others. So if their significant other is driven by them being able to perform sexually, they're going to take that Viagra. But if their significant other, doesn't look down on them when they don't take their blood pressure medication, doesn't look down on them when they don't take the diabetes medication, then what happens? They're not going to do it, right? So we got to have the same onus on our men and our cousins and our family members when they don't take their medications, as if they're slapping you across the face, right? We got to be just as serious from that standpoint there. So again, like I said, I don't want to talk to you guys long. I'm not sure how long we've been talking for, but we had a great discussion today on men's health. So we talked about prevention. We talked about sexual reproductive health, why is it so important for the men. We talked about the substance abuse, a huge issue that men are dealing with just all across the board. And we'll have medical spotlights throughout the month focused on these topics individually. And then we just talked about the emotional health, right? The emotional health is big for men because, again, like that drives everything. Like, and you can't tell them that though, because they think they're invincible, right? So you can't tell them that their emotions and their mental health being weaker or lower than others is what drives all these things. But like that's what it does, right? Hey Calvin, thank you for joining. So that's the issue where we're at now, right? So again, I'm gonna leave y'all be tomorrow.
Thank you for listening to this episode of the Lunch and Learn with Dr. Barry. If you want to find out more about the episode, please go to www.lunchlearnpod.com. That's www.lunchlearnpod.com for the show notes and any links that may have been mentioned in today's episode. If you're interested in joining the Lunch Learn Pod community, head over to either the website lunchlearnpod.com or join us on Facebook and Twitter with the same username, LunchLearnPod. And again, you can find all of these links on the website. If you have any questions, any comments, or any requests for topics to debut on the show, please let that be known, and don't forget to use the hashtag LunchLearnPod when you're listening to the episode. Again, I want to thank you for taking the time to listen to today's episode, and I'll see you next week.